So I'm also with a nonprofit organization. We also do caregiver relief, caregiver support. We have medication screenings, health and wellness programs, ombudsmen, health and wellness, and caregiver support. We service 10 counties. That's what I was looking for because I don't want to miss any, but Travis, Williamson, Llano, Fayette, Caldwell, Hayes, Travis, Bastrop, Blanco, and I can't think of the other one. I'm sorry, guys, but it's 10. So I'm here to talk about Medicare. Open enrollment is coming up October the 15th through December the 7th. This is the time that if you're not pleased with your Medicare policies, if you have Advantage plans or your premiums as far as your Part D for your drugs or prescriptions, if you're thinking about going back to traditional Medicare or original Medicare, this will be the time for you to make those changes. Sometimes we get telephone calls. People just want to say, hey, I have a drug plan. I want to make sure I'm getting the best bang for my buck. I want to make sure I'm, that my plan is the best plan for me as far as my drug coverage or even my health coverage. And we can do plan comparisons for the consumer to see if they're actually getting the coverage that they need for their health and their prescriptions. So as you know, may or may not know, because I'm not sure who's new to Medicare or who's old school to Medicare, but Medicare is federally funded. You have to be 65 years old to receive Medicare. You also have to be done work 10 years, put in 40 quarters. You also have to be a citizen. You can get on Medicare if you're 65 and under, if you have a disability. But most people, once they turn 65, can start receiving Medicare if they put the 10 years in of the 40 quarters. So Medicare is broken down into 3 parts. Part A, which is your hospitalization and your inpatient. Part B, as in boy, is your doctor's appointments and your outpatient. Part D, as in drugs, of course, is your prescriptions. Medicare allows you to pick 3 ways to have coverage. You can remain on original Medicare, which is parts A and B. Medicare will cover 80%, and you are responsible for 20%. Then you will also have to pick up a Part D plan to cover your prescriptions. Then you have Part C, which is the Advantage plan that bundles parts A, B, and D together to cover your Medicare. This is you would choose your plan with a private insurance company, Blue Cross Blue Shield, Aetna, WellCare, United, Humana, Baylor Scott and White, whichever is determined by your covered area, which is determined by your zip code. And you choose your plan that best suits your health care needs, drug coverage with the private entity. Or you can do a supplement, which is Medigap, which allows you to be on traditional Medicare that covers parts A and B, and Medicare covers 80%, and you're responsible for the 20%, but the Medigap covers the 20% that you're responsible for. Medigap does not include Part D either for your drug plans, so you would have to pick up the Part D to cover your drugs. Now, most people say, well, Yvette, what should I choose, or who should I go with? Should I take get a supplemental plan? Should I stay on original Medicare? Should I pick up an Advantage plan? And we always just say it's according to your financial responsibility, how many doctors you see or how often you go to the doctor, what hospital you would like to go to, and of course your prescription coverage. Medicare also has 2 programs. One is state funded, that's called the Medicare Savings program, that will help pay for the Part B premium of $170.10. Now, we found out that it will drop, I think $7 or maybe $6. I think it's going to be $164 and some change for 2023. That's state funded through Medicaid, but you have to have Medicare to qualify for the Medicare Savings program. They also have one that's federally funded. It's called Extra Help or Low Income Subsidy that helps with your prescription costs and your prescription plan if you have a separate plan. Now, some people say, well, I don't take prescriptions, so I don't need a plan D, as in drugs. That may be true, but if you don't sign up for your Part D when you turn 65, you will face a penalty of 1% per each month that you don't have Part D, which is 12% annually. Also, if you don't sign up for Part B when you're eligible, and I say eligible because you can work past 65, and we'll discuss that later. But if you don't sign up for Part B, you will also face a penalty of 10% of each year you don't have Part B. And it doesn't go away unless you qualify for the Medicare Savings program. So people will ask too, if I work past 65, because a lot of people are doing that, do I have to sign up for Medicare? No, you don't have to sign up for Medicare if you have a creditable coverage insurance through your employer. And your HR will be able to tell you if it's creditable or not. We do recommend that you go ahead and sign up for Part A because it's free. You've already worked and paid into it. And that way you'll just have extra coverage for your hospitalization. But once you decide to retire, you have 8 months to sign up for Medicare without facing a penalty. Now, so, yeah, 8 months. You have 8 months to sign up once you retire to sign up for Medicare without facing a penalty. So that'll give you a little leeway to research and find you a plan that's going to work for you. So if you're turning 65, you have what we call an initial enrollment period. And that is, you have 7 months to sign up for Medicare during the initial enrollment period, which is your 65th birthday. So you have 3 months prior to your birthday month, and then 3 months after your birthday to sign up for Medicare. So you can, I'm a December baby, so that's that's September, October, November. So in September, I can start looking for my Medicare plan, but it won't be effective until December. And then if I'm slow about it, then I have until March to sign up without facing any penalties. But that means you're going to delay your Medicare if you go past your birthday month. So you want to go ahead and start researching and finding out which way you want to go with your Medicare healthcare, and that way you could get started on time. Another thing is a lot of things that we're seeing is people with open enrollment, you'll start getting a lot of literature, a lot of phone calls, a lot of incentives. We offer this. We'll give you $100 in groceries. We'll give you $50 in groceries. We'll give you over-the-counter prescription card. And most of the Advantage plans, they already offer those things. So if you're currently on a plan and you think you want to go to another plan, just call your plan and say, hey, what benefits do I have? Do I have over-the-counter prescriptions? Do y'all offer anything? I think they call it like a health wellness or healthy choices or something card, a health card. And that is usually $50 to $100 to help buy healthy meals. So just call and follow up with your healthcare provider to see what they offer. Another thing is a lot of people like to go with Advantage plans because of the prescriptions. The dental and the eyeglasses. So the eyeglasses, of course, is very good and beneficial. Dental, on the other hand, is only like preventive. So they will allow you your 2 cleanings and your x-rays. But if something happens, dentures, extractions, a root canal, a bridge, or anything like that, you may have to pay out of pocket because it doesn't cover that extensive work. Just like I say, just preventive. So just be careful with that. I always tell people to get research be informed, call one of us, a benefits counselor, so we can discuss, your concerns and what's your pros and cons of what you need. And I always give this example too. My mom has a kidney transplant. So of course, before I got involved with her health care, she had an Advantage plan. So I'm gonna give you an example of Advantage plan versus supplemental. So she has like 5 or 6 specialists, which is $35 a pop. She has, and then sometimes they'll order MRIs or lab work or X-ray, or if they need to look at something or review something, or she has an issue going on. So that's $35 a pop to see 6 or 7, because she just got a neurologist. No, something for her GERD. So we've added another one. So when you do that, you're spending all this money, the $35 a pop, because I went with the lowest for her specialist because she has so many. And I also went with a plan that covers her kidney transplant medication. So that's why I say you have to get a plan according to your healthcare needs. So if I would have known what I knew now, I would have put her on a supplemental plan, because she tends to stay in the hospital a lot. Plus she goes to see quite a few doctors, specialists, and then they order new things, X-rays or whatever, X-rays, MRIs. And so if she had a supplemental plan, she wouldn't have that out-of-pocket cost. We would just go, show the card, and then that's it. Now, she still doesn't have bills, because they will let you know on the Advantage plan, this is your out-of-pocket cost. So Advantage plans have co-pays, deductibles, and co-insurances. So if you the type of person that don't want any out-of-pocket costs, you just go in there and show your card. The Advantage plan, not the Advantage plan, the supplemental covers that 20%, and you don't have to worry about getting a bill. Like if you have surgery, you have your surgeon, then you have your anesthesiologist, you'll get a separate bill for that. So, but with the supplemental Medigap, that will cover that out-of-pocket cost. Okay, so I always say, like, Medicare give you these 3 options. They kind of work like car insurance. It's good to have just in case something major happens. You have it. But then if you just need coverage to get by to not be penalized, you also have that too. So I call the Advantage plan, like, if you can't afford a supplemental, because they do have, you have to pay the Part B premium, which is $170.10. Then you would have to pay a premium for your Part D. Then you also have to pay a premium for your Medigap. So that's pricey. But with the Advantage plan, the premiums usually start at $0. You don't pay an out-of-pocket price when you go see your primary care person. They don't start making their money until you go see a specialist, MRIs, physical therapy, get your blood drawn, and things of that nature. So that's the difference. And of course, if you want to roll the dice and just stay on traditional Medicare, then you pay 20% out of pocket, and Medicare pay 80%. And that's just people, they be like, I'm healthy, I don't really go to the doctor, I'll just take my chances. But then if something catastrophic happens, you're in an accident, you have a stroke, a heart attack, or get cancer, you have this out-of-pocket cost of 20%. So you just want to be mindful. We can't project the future, but you want to make sure you have the coverage you need if something tragic happens. Another question is that I get asked a lot, and just be careful with it. Do not give out your Medicare number, Social Security number, birthday, any personal information to anyone unless you have reached out to someone, made an appointment, made that contact. Like I say, you're going to get a lot of calls. You're going to get a lot of literature. So you don't want to give out any information, because they will take that and then start billing things to your Medicare account. And then it's going to be a big mess. And sometimes they're so slick, like they'll call and say, hey, my name's Yvette, I'm with Humana. Can I talk to you about what we're offering this year for the 2023 year? Then they may give you some personal information. Oh, I see you're diabetic. I see you have high cholesterol. We can offer you A, B, C, and D. Would you like to hear what we have to offer? And then you agree. And next thing you know, they have changed you from your current insurance to Humana. And I'm just saying Humana because they haven't done it, but I know companies that have done it. Excuse me. And then it's a big mess. So be careful what you agree to. If you have any questions or concerns, reach out to the benefits counselors or Natalie, and she can direct you to us. If you suspect fraud or anything that doesn't seem like it's right, reach out to Natalie or BC. They have the Medicare patrol that we can report those fraud issues to, or if you suspect anything, and they'll investigate that and determine if it was fraud or not. So be careful. Like I say, open enrollment is October the 15th through December the 7th. So that's the time to call us or reach out and see if you need to make changes. If you're pleased with everything you have, then by all means, you don't have to do anything. But if you've got new prescriptions, and I know a lot of people do this, they get new prescriptions and it may not be covered up under the old plan. So they'll call and say, hey, I got this new prescription. I just want to see if it's a plan out there that'll help give me better coverage than what I currently have. And we can also do that. We can look into that. We can compare plans, walk you through it to get you, like I say, the best bang for your buck to make sure you have what you need for your health care. I'm simply trying to see if I forgot anything. We can start answering questions, and if something comes up, I can kind of go from there.
Perfect. Let's see. You may have touched a little bit on this, but somebody, let's see. Just offering maybe some more advice on planning for long-term care under Medicare.
So Medicare doesn't really have long-term care. Like if you want to get into a nursing home or assisted living, you should look into long-term care insurance. Get you a policy because Medicare does not provide long-term care.
Perfect. I mean, that's not perfect, but thank you.
Right. I know it's saying it doesn't do it.
Right.
Now they provide care, like if you go into a facility for occupational therapy and physical therapy, but no long-term.
Right. And actually speaking to that, how does that work for those individuals who have never experienced like a hospital stay, and how Medicare kicks in and what's covered for a patient if they need some assistance beyond the hospital, like in a skilled nursing facility?
So if you pick a plan, like if you're on an Advantage plan, anything, the first 20 days are free. Medicare covers the first 20 days. So, but if you pick an Advantage plan, of course, it's X amount of dollars per plan. So $167 a day or $187 per day. So that's your out-of-pocket cost. If you have a supplemental plan, like the Medigap plan, where that 20% is covered by the supplemental. And then with Medicare Original, of course, it's 80-20, so that's 20%. But it's locked in though, and I'm not for sure what the numbers are because it's changing. I want to say it's like 180 something per day, but it's going to change. And the crazy part is they have open enrollment in October, and then we get changes and updates on incomes and Part Bs in November. So it was changed. But when it comes to the skill set part, it's 80-20 on original. Then if you have a Advantage plan, it's whatever it is per day after the 20th day. And then the same thing with the supplemental, but the supplemental covers the 20%.
Thank you. So we have several questions coming in, which I love. So one of the questions I have here is, what are plans G and N?
So G and N is a supplemental plan, the Medigap. G is the popular plan because it provides the most coverage with the, so it provides the most coverage compared to N. And then N is the next popular plan because it's a little bit less in price point than G is, but they basically do the same thing. The deductible may be a little higher on N. G, I think is 233, but I think that's decreasing too come November. But they have a price point. The deductible on all supplemental plans are like 233, and that's under Part B. So that's your doctor's visits or your durable medical equipment. Once you reach that 233 deductible, then everything else is taken care of.
Okay.
And like we can't, like a BC, we cannot sell the plans, the Medigap plans. We can just give you the information on those plans. And y'all can look things up on the Medicare.gov website. You could create a username and password. Then you can go in there and just play with it. You can't mess nothing up. So just go in there and play with it. Put your zip code in. Look at the Medigap plans. Look at the Advantage plans that's in your area. It'll give you a breakdown. Now, if you don't understand it, I'll be glad to walk through it with you. You can call and set up an appointment with, it's 3 of us. So you can call and set up an appointment. We can do virtual, or you can come in person.
Sorry about that. Thank you. And so just so everybody understands, when Yvette says BC, she's meaning benefits counselor. No, it's fine. Yeah. And again, I want to just remind everyone that the benefits counselor program and the benefits counseling program at the Area Agency on Aging is free to you. Again, like Yvette mentioned, she's not trying to sell you anything. She's just there to help guide you through the various options and understand this whole process and all of the plans and Medigap, everything you need to know.
Yeah, we just, first, I don't get paid outside of my paycheck. I don't get any kickbacks, none of that. We're just a resource to give you the information that you need to make sure you have the best care, healthcare wise.
Thank you. I just wanted to remind everyone about that. The next question we have is regarding prescription plans. How do they compare to using like the discount coupons on like GoodRx?
So the thing is, you can still use GoodRx, but you have to have a prescription plan in order to avoid those penalties. And what happened is some people say, well, I didn't take prescriptions, so I didn't get the plan. And then you get older and something happens and you get Eliquis, a blood thinner, and it's very pricey, or you get insulin. And so then you're out there having to pay all this out-of-pocket costs because you didn't get a plan. And then you have to try to get a plan. And if you don't get a plan within October 15th through December 7th, you have to wait a whole nother till October comes. And so it's just best to get, like, if you don't take any prescriptions, if you're going to get a Advantage plan, then of course it's covered. If you're going to get a supplemental plan, Silver Script has a plan that's like $7. Get the $7 plan, you're covered, and you don't have to worry about that penalty down the road.
Thank you. The next comment and question I have here is someone who says, I'll turn 65 in January and just signed up for A and B. I chose a salesperson through a recommendation. He said that I will need to sign up and get a card before I can opt into Medigap. Wow. I did not see an option to sign up for Part D. When can I do that?
So once you get your Medicare card and it says effective in January, you can sign up for your Part D. Part D, you don't sign up like through Social Security. You have to go, like, you can go through Medicare.gov, or your agent could help you sign up for Part D when he signs you up for Medigap.
Perfect.
And they usually do that. They do all of that together.
And then someone asked, like, what does the Medicare enrollment process look like?
That's a good question. So I will tell you to go ahead and enroll as early as possible during that first initial 3-month period you have, because we don't know. Social Security could be on their job and you could get a response back in 2 weeks. You could get a response back in 3 months. It just depends on how they're feeling that day. So that's why you need to go ahead and get started during that initial enrollment period. So like I said, I'm a December baby, so I could start in September, October, November. Yeah, so September, I could go on SSA.gov sign up for Medicare. They're going to ask you, the application process, and then they can process it. And that way, it's not going to start till December. So it's not like you're going to start ahead of time. It's just that you taking care of your business, just in case there's some delays or they need more information. You don't want to be scrambling the month of your birthday trying to get, your Medicare. So go ahead and sign up. And if you're going to work past 65 and you don't have insurance coverage, you could go ahead and sign up for your Medicare without signing up for Social Security. But once you sign up for Social Security, they automatically sign you up for Medicare.
Thank you. The next question is, can my monthly premium for Part B be reduced? I am unemployed and have been for 1 year. When I signed up for Medicare A and B, they based the premium on my 2020 income. So they're asking again, can my monthly premium for Part B be reduced?
It will be reduced once you file your taxes for 2021. Because they'll go off of your that's how it's based determined on your taxes. So once you file for your 2021 taxes, it should reduce if you made less money. And if you don't have any income coming in, then reach out to me and we can do a Medicare Savings plan if you're in the income and resource guidelines. We could do the application, and it takes about 90 days because Medicaid is running behind. But if you don't have any income coming in and your savings is not over $8,000, then give me a call.
Perfect, thanks. I don't know if you can answer this, and if you can't, that's fine. I will find the answer and provide it to this individual. Is it possible for a loved one at age 85 who has exhausted their skilled nursing benefits to still buy long-term care insurance? Do you know that answer?
No, I don't. And if they do, the thing is, okay, so if they do purchase a plan, it's going to be very expensive because they are 85. But if they have exhausted their funding and they're in a facility that takes Medicaid, they can apply for Medicaid, nursing home Medicaid.
Okay.
Are they an assisted living facility or a nursing home? Because I can't see the question.
To the individual who asked this question, you're welcome to drop that in the chat box.
So it's a nursing home. If she's
nursing
in a
home.
Yeah, I see. It popped up. So if she's in a nursing home facility that accepts Medicaid and she has exhausted all of her resources, she can apply for nursing home Medicaid. And the resource for that, the income is $2,539. She cannot make more than that. And she can't have over $2,000 in resources and assets. And there's savings accounts, stocks, bonds, annuities, IRAs, 401k. But make sure if she has any property or anything lingering to get a TOD. And that's a transfer on death deed that will protect her property from the Medicaid estate recovery program that's attached to the nursing home Medicaid.
And if somebody wants to do that, who would be the best person to help them do that? Could that be like the social worker at the nursing home, or?
To apply for the nursing home Medicaid, yeah. The TOD, no. The TOD is very simple. You could actually do it yourself, but if you prefer someone to help you, Texas Legal Service Center does this free of charge for people 65 and up and people 65 and under with a disability.
Okay, that's really helpful to know. I also want to just remind everyone that everything, like the resources that we're talking about and any questions that we actually don't get to, we can, it will be provided in a follow-up email. So like the Texas Legal Services Center information, we'll provide their contact information in the follow-up email. And let's see. So the next question I have is, does Medicare pay for hospice?
Yes, it is included. They will just, if you have a hospice center in mind, reach out to them and talk to them about how it's is paid for, but they do hospice and palliative care.
Yes. And I also, speaking of hospice, I love when people bring this up. I encourage you to look into hospice. It's not just end of life type of care. Hospice services are provide additional support to families and the individual if the individual has been diagnosed with a terminal illness. And for example, let's say your person is living with some type of dementia, and they are getting to a point where they need a lot more assistance, and don't have a 6-month, life expectancy still, you can still access hospice care, which will provide additional support. And I'd be happy to chat with you. And I don't know if you have any more insight on that, Yvette. I just like to put that out there because some people just think that it's just end of life. And then
right. It's not just end of life. You can help. Max is making his debut. You can, it's very informative and helpful, and it takes the ease off. Like, it's not like Natalie said, it's not just end of life. They can assist you with other things. And if you're scared of the hospice part, do palliative care and then transition into hospice. But right. Yeah, try it. I mean, reach out. It's a good program. And it has good benefits.
Right. And if your person covers, or is eligible for it, they can be, it'll be covered by Medicare.
Yes.
So the next question we have is, what are the differences between Medigap plans and Part C plans?
So the difference is, like I said before, my little analogy with insurance, liability, full coverage. But I don't know if that's a good analogy, but that's kind of how I do it. So the Part C, which is Advantage plan, it covers parts A, B, and D all together. One-stop shop. You don't have to buy anything separate. It starts out at zero cost. And like I said, they don't make their money until you start going to the doctor to see a specialist or MRI, physical therapy, occupational therapy. So if you're not sick and you don't have extra income to get a supplement, this will have you covered so you avoid penalties and you still have the coverage you need if something happens. The Medigap, on the other hand, if you already know you're sickly, this is another thing too. So during your initial enrollment period, when you turn 65, if you already have a lot of health conditions and you can afford a supplemental plan, then I would advise you to get one. Because when you get to all that out-of-pocket costs start adding up, it could be a little expensive. If you get the supplemental plan at your initial enrollment period and you already have health conditions, like some people might have had cancer before or a stroke or something like that, they don't do medical underwriting during your initial enrollment period. Whereas some people will get an Advantage plan because they're like, I'm not sick, so I get the Advantage plan to have the coverage. And then 5 years down the road, something happens. They have a stroke or they have cancer or they have a heart attack. And then they want to get the supplemental plan. Well, you're not going to be able to do that because they're going to look at you had a stroke or cancer or a heart attack, and they're either not going to cover you or your premium is going to be a little bit more expensive. So the difference between them is no premium costs. You have co-pays, deductibles, and co-insurance. The Medigap covers all your out-of-pocket expenses at 20% that you would be responsible for through Medicare, but you do have a premium and you do have to purchase a standalone drug plan. But you have the comfort in knowing you won't have those out-of-pocket costs, the bills coming in and adding up per se.
Thank you. We also had another question. How would one go about accessing Medicare if they move to another state? So it's specifically asking, how does Medicare work when you move out of state? And let's say you already have Medicare in that state and you're moving to Texas, or vice versa. You're in Texas, you have a Medicare plan.
Oh, if you have Medicare, traditional or original Medicare, you don't have to do anything. You would just have to change your drug plan to work for the area if you move to California. So you would have to get a new drug plan for California versus the drug plan you have in Texas, because it's not going to work in California. And California is very different over there. So they give you 61 days to make that transition when you move from state to state. And if you have anything open in the state, like California has Medi-Cal and we have Medicaid, then you would have to close your Medicaid here in Texas so you can apply for Medi-Cal in California, and vice versa. If you have a family member that's in California and they move to Texas, you have to close out the Medi-Cal in order to apply for the Medicaid over here. So, and they give you 2 months to do it.
Thank you for that. That's always a tricky situation when
Yeah,
people
but
are
if you,
moving and they are already receiving Medicaid benefits in another place. Thank you. So I just want to clear that up. The Medicare, like traditional or original plan, stays the same because that's at a federal level, like that follows you. But what would need to be changed is the drug plan that is specific to the area that the individual will be living in.
and if you have an Advantage plan, of course, you have to transfer, because the Advantage plans are determined by your zip code.
Okay.
So it won't go from state to state.
Okay.
But if you have another thing about the supplemental plan or the Medigap plan, if you live abroad, say you stay 6 months in Hawaii and 6 months in Texas, then you would a supplemental plan would be beneficial because it's not going to cover in Hawaii. Now, if you go over there and you're on vacation and you fall and break a limb, your leg, then of course it's going to cover the emergency, but it's not going to cover you staying there for 6 months. So that's another thing to look into. If you travel a lot, you may want to look into the supplemental plans.
And will that include like foreign travel as well? We had a question here that says, which plans cover foreign travel?
Yeah, the supplement, Medigap.
Okay. It says, the next one says, I heard there was a new law that made the max out of pocket for drugs $2,000 per year. Is this only for people who get that part? And is that true? I don't.
Now that I haven't heard. We just had a meeting too about the drug plan coverage. You know, Biden did sign a new law, but we don't know. It's not like effective. I know they transitioning everything because he's supposed to be helping with the insulin and things of that nature, but we haven't got the information on how it's gonna work.
Wonderful.
Because it's still going through its little process.
That whole process. Let's see. So we had another question. If there are, yes, there are other area agencies on aging in other states. And correct me if I'm wrong, every AAA has a benefits counseling program, correct?
They should, yeah. So, and some of them have they do dual stuff. So yes, they may do benefits and something else, but they should be able to give you information that you need.
So yes, and that's the area agency on aging. They are in every state. There are multiple ones in each state that cover certain amount of counties. This is a federal program, correct?
Right.
And so
state funded. So
yeah.
Each state, like San Antonio has their own COG, we have our own COG, Killeen, Temple, that way have their own COG. So Capital Area Council of Governments, and we fall up under the Area Agency on Aging. So just reach out and they should be able to help you in that state.
And I also, I have people who contact me who might be a long-term or a long-distance caregiver, and their person is in another state, or they're in another state and just happen to call us. I can always find out, specifically which area agency on aging covers your area. So even if you're somewhere out of state or you're caring for somebody in another state, please still reach out. We can help find out specifically who to call for these particular services. The area agency on aging is always a really wonderful go-to and where to start resource that I share with people, whether you're local or out of state. So the next one says, I am on Obamacare. Do I have to change to Medicare by my birthday, or can I continue until the open enrollment period is over?
So open enrollment and initial enrollment period is two different things. So if you own Obamacare, if you turn 65 in January, you're no longer eligible for Obamacare. You have to apply for Medicare. So
can I jump in really quick? I just, so this person says my birthday is in September, so I stay on Obamacare until the end of enrollment period, i.e. December. Did you just answer that?
So this is the thing. So September is your birthday. So October, November, December, you have to be on Medicare or you'll face penalties.
Okay. So the next one is, yes, you can. This one asks, can I have an appointment with the benefits counselor through phone or Zoom instead of in person? Absolutely. Yvette mentioned a little while ago that they are holding virtual and by phone appointments.
And you could come in, but we haven't started back traveling to other people's houses. But if you want to set up a Zoom, we can set up a Zoom. I can share my screen. We can walk through. It's real simple from the comforts of your home.
That's really nice. I don't know if you can answer this or not, but if not, we'll find out the answer again. Can you discuss for-profit hospice versus not-for-profit hospice?
No, I'm not familiar with that.
Yeah, okay, that's fine. And we will find that out. Let's see. Does Medicare, and sorry if you've already addressed this, does Medicare Advantage have a max out of pocket?
They do.
Okay.
But each one is different. So it can range anywhere from $2,000 to $11,700.
Okay.
Just depends on the plan.
That's a big range.
Oh, yeah.
Okay. I think you already touched on this too, but this one says, how does original Medicare work when you're traveling in the US, especially if you're away from home for several months?
So Medicare, if you're on traditional or original Medicare, you're good to go. If you're traveling, because it goes state to state. Now, if you travel abroad, it doesn't work abroad. It'll cover emergencies, but not if you're living. But if you're going state to state, you're good.
Okay. Again, I apologize if you've already touched on these. It might be helpful to just like repeat some of the information. Right. If you are currently covered by Obamacare plan and you received Medicare coverage, are you required to cancel the Obamacare since Medicare's coverage starts, or once Medicare coverage starts? Yeah,
it should cancel. It should cancel itself, but you're not supposed to have to, because okay. It's one. Usually how it works, once you turn 65, they usually boot you off and start telling you 65, you need to sign up for Medicare, your policy ends, blah, 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 December the 31st or whatever. So they should let you know, but you can't have both of them. You also can't have an Advantage plan and a Medigap plan. You have to choose one or the other.
Okay, that's good to know. Are Medigap plans based on your income?
No. Medigap is based on your age and your health. But like I say, if you do it during your initial enrollment period, when you turn 65, they don't do the medical underwriting.
Okay. So again, is there Medicare coverage for palliative care with a dementia diagnosis? Well, yeah, like let's say it's not a hospice service, but more palliative care. Does Medicare cover just palliative care?
I think it does, because it's, and I want to say, don't quote me, I might have to look this up and get back with you, Natalie, but it's up under that umbrella. Okay. Because what the whole thing is, they really try to keep you out of the nursing homes, out of the hospitals. So anything that they can do that's within the home, except for the long-term care. It's covered. It's just that you probably have to go through your doctor, or either, like I say, reach out to it, because I know word of mouth. People say, "Oh, I have hospice." Like my mom was on palliative care. Her doctor did a referral for her to receive palliative care, and they did the process and filed on her Medicare and all of that stuff.
The same. I had a similar experience too.
Right.
Okay. So the next one is, I am on disability with Medicare. Are there any changes when I turn 65?
So yes. So once you turn 65, when you're on disability, you get a do-over. So anything you want to do, you can do it over. If you want to get a supplemental plan, because if you're under 65, the supplemental plans, the Medigap plans are really, they like over $400. So if it's something you want to look into now and want to get a supplemental plan, even though you're disabled, if you want to get a supplemental plan, this is the time to do it, because they won't do the medical underwriting. If you wait past that point, your initial enrollment point, then they'll do the medical underwriting. So you want to be real careful on your care and what you need, and set up and decide, is if I can afford this, is this what I need? Then go ahead and do it now. Because what they'll do is, like I said, if you wait 6 months down the line, or a year or 3 years, they're gonna say, "Oh, she received disability. She had A, B, C, and D. How's that gonna affect the policy?" So they may insure you at a higher rate, or they may not insure you at all. But yeah, once you turn 65 and you're on disability, you get a do-over.
Okay. The next question is, does Medicare Advantage cover anything if you have an emergency out of the US?
Yes, if you have a heart attack, a stroke, if you break a limb, a bone, you in a car accident, it will cover the emergency. What it will not cover is 3 months later, 6 months later, 8 months later. They're gonna be like, "Nope, you're out of network," but they will cover the emergency.
Thank you. So this one is, my mom is on extra help for the drug plan. Could you please share some tips on how I should select a drug plan for her? She is in her early 90s and has Alzheimer's.
So with the extra help, are they paying 100%, 50%, 80%? Because if they're covering her prescriptions, it doesn't matter. Whatever you choose, a prescription is going to be covered, because the extra help is paying for it. But you always want to make sure when you're choosing a drug plan, if you have 10 drugs, you want all 10 of them covered. Then you want to go with the lowest cost of the 10 drugs that's being covered. When you go to the Medicare.gov website and you compare those plans, because you can go in there and put your prescription costs in there, or you could create a username and password, and it'll have her prescriptions in there, because of course they talk to each other, the computer. And you can go in and adjust. She doesn't take this, she takes this, add, subtract, or whatever. Then it allows you to compare her current plan with 2 other plans. So you can see if her plan has got better coverage than the other 2 plans, and it's going to give you the lowest cost to the highest cost. So me and this lady looked at a plan the other day, and her plan was the best plan. She was like, "Oh, okay, well, we're good to go." So people will do that. But if she's on extra help and they're taking care of the prescriptions, it's not really a big deal on what she has, because it's covered through the extra help.
And I was about to ask, and you answered. I was going to ask if you or the other benefits counselors can help somebody figure that out with all of their medications. And
Oh yeah, you could call us, give us your prescriptions. We'll put it in. We'll compare it. We'll email it to you or mail it to you, so you can look at it, and you could call us back once you get it, and we can look at it together. Yeah, we could do it. We could break that down for you guys.
Okay. So we have another question that says, I'm a little confused about Medigap. If you can't have Part C and Medigap.
Both of them cover. I'm sorry, Natalie.
Oh no, it says so it covers 100% of cost, but we need to purchase the drug plan outside.
So it does not. Okay, so you can't have both Medigap and Advantage plan because they both cover they cover your Medicare. So it doesn't make sense to have both because it's like you can't have both because they both do the same thing but differently per se. I'm trying to not be confusing. So the Medigap does not cover 100%. It's like 100% is being covered because Medicare covers the 80% and you have 20%, and the supplemental supplements and covers that 20%. So and it does not include the drug plan because Medigap only covers parts A and B. So D is not included. Whereas the Advantage plan covers part A, B, and D, and that's all included. I feel like that's still gonna be confusing. Like, I'm right in my head, but the thing is, you can't have either or. You have to either get the Advantage plan or the supplemental plan. Because the Advantage plan, you have copays and deductibles. The supplemental basically covers the copays and deductibles, the 20%.
Wonderful. Clear as mud. I'm just kidding.
Right.
Again, please contact Yvette, and I'm sure she can help you understand that, again, specifically to what your person or your situation is. I've heard, so the next one is, I've heard this too, but what does the donut refer to?
So the donut hole, oh my God. Even we be confused on this, okay? So I have to go real slow. So say the donut hole is, they don't want us to say donut hole, but they say catastrophic, still the donut hole. So that you get your prescriptions maybe every 3 months. And so it's like $80, $80, $80, $80, donut hole, $220, $220, $220 come out of it, $40, $40, $40. And it just depends on what tier the drug is. So it's in tiers, like tier 1, tier 2, tier 3, tier 4. And please call me on this because I don't want to get it any more confused than what, because I'll be confused. I have to like look at it. It's hard for me to describe it without looking at it. So when we met with an insurance agent and we was like, donut hole. Like we still be confused about the donut hole. And the only reason why I kind of understand it is because my mom went through it. So it's like we was at like $120 and it bumped up to $2 something for like 3 or 4 months, and then it just plateaued to like $84. So, but she takes Eliquis, she has insulin, so those tier drugs tend to plateau. It kind of balances out, but it don't balance out because they could just, to me, just make it all one thing. Like we just gonna pay $100 for a year versus 80, 200. 40. I mean, just give us just one little simple step. They make it so hard.
Yeah, I agree.
But basically, it's just that they give you this drug at a lower cost, and then you pay a higher cost once you plateau to the donut hole, and then you come back out and you back at a lower cost.
Okay.
Clear as mud.
Yeah. This next comment is, I've been told that Advantage maximizes profits for the insurance companies, but Medigap gives you better value to the consumer. Do you have an opinion on that?
Again, it all just depends on what coverage you need and how much you can pay. It just boils down to that. They give you these options because really, if you're on Advantage plan, you don't go to the doctor, they don't make any money because you don't pay a premium cost. If you get a supplemental plan, you pay a premium cost like you do with regular insurance. But if you do go to the doctor, it's covered with that 20%. Whereas the Advantage plan, they're going to have to pay copays, deductibles, or co-insurance. So everything is a profit. They're going to make money off of it regardless because that's insurance.
The next one is, if you sign up for a Medigap policy during your initial enrollment period, but then several years later you want to change your Medigap policy, let's see, your Medigap policy is new. Is the new policy subject to a health evaluation? Like it's
Yeah, the medical underwriting, it can be.
okay.
But the thing is with the supplemental, with the Medigap, they all basically cover the same thing. Like if you look at it, like I said, if you get a G plan, G covers, I mean, if you go with Blue Cross Blue Shield or Mutual Omaha or some off brand that you don't know, they all offer the coverage. So it's not going to be any difference but the price.
Okay.
Like Blue Cross Blue Shield may be a little bit more expensive because it's Blue Cross Blue Shield versus security. I know
Right.
security, whatever.
And have you ever seen, or I don't know if you can speak to this, but have you ever heard of someone being denied because of a new health problem if they're trying to switch that policy?
Not denied, maybe at a higher cost. But my thing is, if you have a health problem and you have a Medigap, don't change. Just stay where, don't change, because it's nothing. The thing with the Medigap, it's not like you're going to be like, oh, they're going to offer something new. It's the same thing. They're going to cover parts A. They're going to cover parts B. They're going to cover that 20%. The only thing is it may increase in costs, like, because they have a obtain age, a community pricing, and age something. So the prices is like a community pricing. It goes up like for inflation, or depending on how many people use it. It works just like car insurance. You know how sometimes your car insurance go up, you're like, I haven't even used it, but other people with Progressive have had wrecks that don't have nothing to do with you, but it calls the community. It calls an increase for everybody that has Progressive. And that's kind of how the community pricing is. Then they have an attained age pricing that, and no matter what age you receive it, it stays the same, which may go in at a higher cost because it never changes.
So follow up to that, this individual is saying, so again, do you have to purchase a separate Part D plan if you pay for Medigap supplemental? Like you have to do that.
So D is not included in the supplemental or original. You have to purchase a separate plan.
And if you don't, then you are penalized.
Yes, 1% per month that you don't have it.
Okay.
And it's based off of right now $33.43. So 1% of that, because they have a median of the cost.
So again, when everyone is looking at their enrollments this year or any time that they're eligible for it, you're advising people to not forget to sign up for that drug plan so that they can avoid being penalized.
Even if you don't take prescriptions at the time when you turn 65, you need to get that coverage. Like I say, Silver Script has a premium that's $7. So that way you don't have to face those penalties 10 years down the line. Because it's 1% don't sound bad until you've been on Medicare for 5 or 10 years. Then it's big, So
sorry.
I'm sorry. Go ahead, Natalie.
No, you go ahead.
So for instance, if you don't get your drug costs, then 5 or 6 years down the road, you need prescriptions. The prescription cost is $30. Then they're going to add that additional 1% or 12% for those 5 or 10 years you didn't have it. Then if you go with a Advantage plan, the Advantage plan is $0, but because you didn't sign up for your Part D, they're going to add that penalty to the Advantage plan.
And then you pay towards that penalty, correct?
Yeah, so if you get a Advantage plan, it's $0 and you haven't been on Part D for 10 years, it is $32, then you paying $32. Okay. But then if you're on a supplemental or you're on traditional Medicare and you get a plan and the plan is $20 and you add that $30 to it, now you're paying $50.
Yes. This is a really good question. And I don't know if you it can answer to this. This question is, can you go to any provider under the Medicare Advantage plan?
No. So Medicare Advantage works just like your job insurance. You have to be in network. If you go out of network, then you pay out of network costs. You want to make sure when you choose your Advantage plan that your doctor takes it, the hospital you prefer takes it. If you already have a heart doctor and all of that, you want to make sure everybody takes Blue Cross Blue Shield, Baylor Scott and White, Ascension, WellCare, whatever you choose. You need to make sure they are in that network. So again, when you choose an Advantage plan, it works kind of like your job insurance. You have an HMO plan and you have a PPO plan, and it works the same in network, out of network. Of course, if you have an HMO plan, you have to go to your PCP. He have to give you a referral. If you have a PPO plan, then you just go where they take the Blue Cross or the Humana or etc. But no, you just can't be bouncing all over the place because the plan is determined. I keep saying your covered area is determined by your zip code. So when you go in or we go in to find you a plan, we have to key in your zip code and it pulls up the plans in that area. And that's your covered area. So you have to stay within that area. And your doctor, your PCP is not going to give you a referral to somebody that doesn't take the premium you have, the policy you have, or Blue Cross Blue Shield, or whoever you have. He's going to refer you to somebody that takes that insurance.
Yes, and I just want to stress this again. You mentioned, if you are an individual or if you're caring for someone who has specialists that are currently being covered under a particular plan, and you're thinking about changing, please dive in and make sure that whatever policy you're thinking about changing to, that it covers those specialists. I know specifically for my personal situation with my mom, she has a wonderful team of doctors that we need and who have been seeing her for years and years. And so, it's just be cautious because, there would be a possibility that if we were to change policies that we would lose one of those specialists that maybe we weren't aware of or, expecting to lose. So
that's why I say when you get phone calls and they lure you in with all these incentives, then they change you and you're out of network. Your doctors are not in the network. Your hospital, you go get sick. Your doctor's like, I can't see you. Then your visit is $130 if you see him. If you don't catch it in time, we can appeal it. It is steps, but just be careful when you change when it has to do with things that doesn't concern your health, because you don't want to for $50 and then your health is in whack because you chose to get a $50 gift card.
Do all plans include vision benefits?
Yes.
Okay. Wonderful.
Yes, all Advantage plan includes vision and dental. Okay. And the vision, they cover, of course, your doctor's visit and your frames and your lenses. You just may have to get the Medicare approved frames.
Okay. Do you know if any of the plans cover out of network doctors or?
They do, but they'll tell you out of network fees could be up to 80%, 50%, or 20%. They'll give you a breakdown of that in their plan. When you do the plan comparison, okay, it'll give you a breakdown of what's covered if you decide to do that.
Again, I don't know if we've already addressed this, but so if you have Medicare A and B, do you sign up for Part D on Medicare, or do you let United Healthcare, for example, take care of Part D? So if you sign up for A and B and you're going to remain on original Medicare, then you could get on the Medicare.gov website and look at the plans, or you could call me, or you could call an agent. Wonderful. Let's see. But if you have United Healthcare with the Advantage plan, it's already included. Okay. This other question is, again, does Medigap cover vision, hearing, and dental?
No, they
No.
only part A and B. No extras.
Okay, so they only cover part A and B, not any extras. Okay.
Right.
Let's see. And then let's see, another question. I don't know if you know this answer, but we can definitely direct you. Is there a program out there that would allow a family caregiver to quit their job and take care of their parents full time?
It is, but just know they only pay $10 an hour. You may not get 40 hours. Texas Health and Human Services have a program called the Community Attendance Service. If you quit your job within 30 days, they will pay a family member to care for another family member. You have to have that in documentation. You have to have it written up that your job, that's why you quit. And then they will pay you. But just know it may be 20 hours, 30 hours, and the starting pay is $10. So.
Wonderful. And we can provide that information in the follow-up email as well. I'm going to drop Yvette's contact information again into the chat. If you want to, jot down her information now, again, it will be sent out following the presentation, but you will receive an email from everyone or from me on Monday with all of this information. I want to make sure that I get, at least in the follow-up email, some of the main questions and points that were asked and given to everyone, so that you just have a little reminder of, we had talked a lot about the Part D and drug plans and Medigap and all of that information. So I'd like to provide you with just some facts and tips and tools in that follow-up email. Well, it looks like those are all of our questions. Again, I thank you for joining us this morning. Everyone who registered for the event will receive the recording and the information that I just mentioned. And I hope that you are all able to get out and enjoy this beautiful day and go maybe watch some Texas football. Go UT. And let us know, again, reach out if you have any questions.